But the purpose of today's practical is to show how to use plyometric training at different stages. So we, Isokinetic, we published a paper in International Journal of Sports Physiotherapy that was 2 years ago on integrating plyometric training into ACL rehab. For that, there's a 4-stage plyometric program. And what I'm going to do is just really show how can you do plyometrics at each of those different stages, why are they important, what are those plyometric tasks, what are those plyometric considerations. And so, yeah, the patient can do everything up until the final stage. So the first aspect of the video is going to be just really taking you through the plyometrics. Jonas hasn't done much plyometric training as part of his rehabilitation, and so some of these tasks will be new for him anyway. But what we're going to do is we're going to start with stage 1. So stage 1 plyometrics are basically to prepare athletes to return to running. So lots of athletes look to return to running around 12 weeks after ACL reconstruction. Most of the time the decision making is based on time, so with a median or an average of 12 weeks. And a lot of the times there's not a lot of criteria, whether that's in practice or in the literature. Some people recommend having a limb symmetry index of 0.7 isometrically, but generally there's not a lot of criteria. The criteria is typically range of motion, that should be 120 degrees, typically low levels of pain, 0 to 1, and sufficient kind of strength in terms of clinical exam. But all of these things are the same criteria that people achieve when they enter mid-stage rehab. So from the point of week 6 through to week 12, there's no additional criteria that supports people in return to running. So plyometric training should be used for multiple reasons. So first is as part of strength and power development, but secondly is also to prepare people for different task demands and try to develop their movement quality. So plyometric training in the mid-stage, the main focus is can we prepare people to safely return to running. Plyometric training in essence is about optimizing athlete stretch, shortening, cycle function. Plyometric training should fit alongside lots of other training variables, so you wouldn't just do plyometric training. So today, if I was to take Jonas through an exercise training session, I wouldn't just do plyometrics. I would see plyometrics fitting as part of 2 different sessions. It can either fit as part of a strength and power-based session, so in the gym, alongside functional strength training. So you would do a heavy load squat, for example, followed by a biomechanically similar plyometric task. And within that, you can utilize what's called the post-activation potentiation enhancement phenomenon, where you do a heavy load squat, and then you do a biomechanically similar power-based exercise. There's actually a temporary improvement in performance if you time it right. But also, it should be used as part of a mixed method approach. So you do strength training and plyometric training to better optimize neuromuscular performance of the athletes. So in the mid-stage, we're not really using plyometrics so much for improving athletic performance. We're more doing it to get the patient used to eccentric acceptance and giving them some early stretch shortening cycle movements. And those stretch shortening cycle movements are going to help them return to running. So there's 4 different types of plyometrics. You've got plyometrics that are bilateral offset, which is basically where you're landing with both legs, but there's a timing difference where you're landing on one leg first and then landing on another leg. Then you've got bilateral asymmetrical, where you're doing a plyometric task, but there's an asymmetrical stance, and you're tending to load one leg more than another. Then you've got bilateral symmetrical plyometrics, where you're on 2 legs, but there's a symmetrical stance, and then you've got unilateral plyometrics. During the mid-stage of rehab, everything's going to be focused on bilateral, so nothing will involve unilateral movement. So there should at no point in the plyometric task really is a patient really in the air without good control. So our preparation here is long stretch shortening cycle, long ground contact times, typically around 500 milliseconds, and this is to try and mimic the demands that we have in running. So Jonas, what we're going to do to start with is I'm going to take you through just a couple of basic plyometric tasks. First off, all I'm going to do is just introduce you to a little bit of low-level counter movement jumps. Okay, so basically just a 2-leg jump. I want you to get used to just this downward phase, followed by an acceleration phase upwards, but then you're going to land on 2 legs. We're going to start literally just really, really easy. If you just come onto the 4th page and just face towards me, ignore the screen for now. All I want you to do is the same squat pattern that you would use, so that you've learned in your rehab. So obviously, normal squat pattern, sink yourself down, feet shoulder width apart, maybe a little bit of a point out. So still make sure you do a good squat pattern. Just want you to sink yourself down, a little bit of a jump. I just want a nice soft landing. Okay, so just have a practice at that. So just do one of those. Good, perfect. So all we're doing in this period is literally just getting them to do a slow counter movement jump. And then obviously this patient already has done squatting and they've also done landing. So importantly, we should already practice a landing task and we should already practice the squat task as well. And we're just going to start off with very, very easy, slow counter movement jump efforts. And importantly, what we don't want here is we don't want Jonas going really, really high, because the higher Jonas lands from, the more load that we're going to have. And we don't want to put a lot of load into the patient at this stage. Most of the loading demands that we're expecting for these plyometric tasks are around 1 to 1.5 times body mass in terms of the vertical ground reaction forces. So we don't want lots and lots of load. So literally, we don't want Jonas going too high. All we're going to do from there, a progression on from just low-level counter movement jumps, is to now still use counter movement jumps, because it has to have the stretch shortening, but I want to get rid of the impact forces. So for this, all I'm going to do is just have Jonas jump onto a box. The reason we use the box is, obviously, the amount of momentum that Jonas is going to have is going to be based on how fast he's landing from the ground. So if we have Jonas jump onto a box, he's not falling from a high height. We're getting rid of most of the eccentric landing. So what we want to use this task for is we want good rate of force development, good power during the jump, but we don't want really high eccentric acceptance. So all we do is have Jonas jump onto a box. It's the same thing, Jonas. All I'm going to have you to do this time is same effort, but obviously I want you to jump with a little bit more intensity. I just want you to land on the box. The same as when you landed nice and soft on the ground. Just want you to jump onto the box, land nice and soft onto the box. Okay, ready? Okay, and jump. Good. Obviously for this is pretty easy for Jonas, but for patients that are in the mid-stage, it's going to be a little bit more demanding. And obviously it's just the cues are just making sure they land softly on the box. And what you want to do is start to make sure that the downward phase is getting a little bit faster as well. So we'll do the same thing, Jonas. What I want you to do, this is more practicing it now, but then we'll just use a series of counter movement jumps. So it could be a set of 8, 3 sets of 8 that you introduce to your patient. All I want you to do this time is just with more intensity. Okay, so I want you to sink down, rather than go slowly through the eccentric phase. I just want you to drop and then jump up onto the box a little bit more quicker. So that downward phase a little bit faster. Okay, ready? Good. Okay. Importantly on this one, what you don't want to do is start to layer up the box too high. What we will see a lot in a lot of YouTube videos, a lot of Twitter videos, is where people are jumping as high as they can, and they're tending to land with their knees really, really high. What we're interested in is making sure that Jonas' center of mass is coming up, but we don't want him trying to get as high as we can on the box. We want him to land safely on that box. So we don't want really, really high boxes where he's landing in a crouched position. So basically, if you only wanted to use one type of plyometric training in the mid-stage, then counter movement jumps onto a box are probably your best source. You're getting rid of a lot of the impact forces, and you're getting slow stretch shortening cycle as well. This will train that slow stretch shortening cycle. If you want to do a test with your patients, you can do a squat jump, and you can test their counter movement jump, and you can look at the differences between the two. This is the eccentric utilization ratio. But to be honest, at this stage, you're probably not going to do too much monitoring. You're more concerned with just visually looking at the patient, making sure they're doing the jump with good technique. As we transition through the mid-stage, the other options we have are going to be bilateral offset type stuff. But Jonas, this time what I want to do is similar to the step up that you've done, obviously a lot of times, so just that single leg step up. This time what I want you to do is to just do the step up a little bit quicker. You're just going to jump into the air and then you're just going to land back on that leg. So I'll just do a quick demo. All it's going to be is just a little bit of a drive up. I just want you to land on that leg, eccentrically accept that load. And you're also going to land on this leg as well. So it's just a little jump up, land, and you're going to come back down. So it's kind of an offset of timing. So he's going to land first on this leg, followed by this leg. But it's the same technique that you're doing in your step up. You want to make sure, of course, that the knee's not falling in. Drive yourself up. Initially, all I want you to do is just to push yourself a little bit faster and then land on that single leg. Use whatever leg you feel comfortable at the moment. Drive up, good. Okay, this time what I want to do, what you can then do here to get more of an eccentric overload and get faster greater force development is rather than going from this position, you just lift the foot up a little bit and then just drive it back down. And make sure, of course, that it's a stable box. But it's just going to be a little drive up followed by a land. Okay, so just if you do that one there. Good, this time a little bit more intensity. As you come down, so look, just drive that foot down into the box. Not, if it was mid-stage, you wouldn't go as much, but for Jonas, he'll be able to get a bit more power. But just a little push up and just land. You want to try and get off that box a little bit quicker. Good. And then again here, you could just go through 3 sets of 8, for example, 3 sets of 6, typically. Version you can alternate on this one is just going to alternate foot positions. So this time, Jonas, all I want to do, drive up on one leg, just want to change legs and land on the other leg. So it's just a little bit of a drive up, little change, and then start out without the drive. I just want you to head into that little position like that. So it's just this time, just a little change up. Good, 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 good. Obviously, start to increase the intensity. Jonas can start on a lower box. This is a reasonably high box to start on. You're probably going to go off a Reebok step or like a 20, 30 centimeter step to begin. And then another aspect you can do in the mid-stage is just using skipping really well as well. So skipping is a form of plyometric training, probably more that you're going to do in the gym, but all you're going to do is just introduce a little bit of skipping, just start to get that intensity a little bit higher. So just for the purposes of the video, all we need to do, Jonas, is a little bit of skipping. So just start out, and then technique-wise, you can start to train in here. You see technique? All I want you to do now, Jonas, is I'm going to add in a little bit more intensity to this task. So rather than just the kind of little laboured push down. When we were doing that task on the box and you were driving down, we want to do the same thing in here. Okay, so as you come up, you're focusing on that little drive down. So it's a little bit of a skip. What we want to do is just push down that little bit quicker in that downward phase. Okay, does that make sense? Yeah? Good, 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 cool, and relax. And then all you're doing here is you're just introducing an early bit of sprint mechanics to someone a little bit earlier than when they're getting out on the field. So technique-wise, obviously making sure Jonas' technique's pretty good, making sure that they're getting that opposite arm to leg drive, making sure that you're getting that push down. But you can kind of teach it initially on this exercise and then transition it into this exercise. But mid-stage, you're not going to do that much plyometric training. It's more just preparing an athlete for transitioning into running. What we're going to do now is focus more on the early stage, the first part of late stage, so stage 2 of the plyometric program. Stage 2 of the plyometric program is about transitioning our athletes to being able to do a bilateral drop jump with really good technique and performance. So our test is going to be a bilateral drop jump. Where the second stage of plyometric fits is that ideally you do some testing. Ideally, Jonas would have a limb symmetry index that's at least 80%. The other exercises that Jonas is doing outside of his plyometrics is going to be introducing him into single leg landing tasks, and then also into, of course, running on the treadmill. So now Jonas is able to run on the treadmill. Our goal is to improve Jonas's linear power and movement quality. And so all of our plyometrics are going to be linear focused, nothing multi-directional at the moment in this stage, and are predominantly going to be bilateral. We're not doing unilateral plyometrics yet. But now we're doing some bilateral plyometrics with higher intensities. So the main focus on this one is now still going to use counter movement jumps as one of our efforts. We're going to predominantly use counter movement jumps and bilateral drop jumps. We're also going to use some asymmetrical plyometric tasks as well, bilateral asymmetrical. But one of the ones that we're going to do here, Jonas, is start to now allow for higher heights. Use a different surface initially. So when we're introducing the tasks, first you want to make sure they're on a pretty soft surface to begin, maybe a trampoline or a soft surface. But all I'm going to do here, Jonas, is I want to step onto the mat and then come into the middle of it And then all I want to do now is just start to do counter movement jumps. I just want to start to increase that height of the jump. So we're going to start out with just with a counter movement jump like you did onto the box. So it's just a sink down, jump, I just want a nice controlled landing, okay? Good, cool, just do a couple more of those. Good, couple more. Good, so technique is pretty good. I'll have you turn around actually for the camera, make it a little bit easier. So what we're going to transition to now is essentially, for the plyometric, you want some vertical and you want some horizontal. Vertical-based plyometrics are predominantly going to be knee-based. Horizontal plyometrics are going to predominantly be hip-based. So you want a mix of vertical and horizontal plyometrics. So same task again. All I want to do this time, Jonas, is rather than jumping upwards, you're just going to jump forwards and then just land in a squat at the end. Okay, so it's just a two-leg cat movement jump, just want to nicely land at the end of the mat. Okay, good. Then just a little bit further. Good, probably a little bit too far. But again, on this one, just think about vertical, horizontal, basic technique, counter movement jump, vertical and horizontal. The main difference between doing this on a box and doing it on a mat here is just the height that Jonas is landing from or the speed at which Jonas is coming into. So you want to make sure that we're gradually now increasing the drop heights. So counter movement jumps are predominantly going to be the early bit of this program. And what we want to start to do now with Jonas is introduce him into slightly higher loads, but also slightly higher stretch rates as well. So we don't want, at the moment Jonas's counter movement jumps are about 500-600 milliseconds, they're quite long. Sporting movements are about 200 to 300 milliseconds. So we want to gradually get Jonas towards those more demanding tasks. What we're going to do to start Jonas is we're going to get you now to do just a split jump. Okay, so the same as the split squat that we did. So obviously you know the split squat. So come into a split squat. What we're going to do then is the same technique. You're going to sink down. I just want you to jump straight up. Okay, so we're just going to jump. I just want you to land in exactly the same position. Okay, so bilateral asymmetrical plyometrics are good because we're starting to put a bit more load on that front leg. But Jonas is not going to go so high as he is in a bilateral jump. He's only going to go about 30 centimeters off the ground. Whereas if we do a really high counter movement jump, he's going 50 centimeters off the ground. So if you head into a split squat stance, cool, sink yourself down. Good, technique's perfect. All you're going to do is just, mostly using the front leg, just want you to drive yourself up. I want you to land in exactly the same position as that, okay? Just jump up. Good, same again. Good, one more. Good, perfect. And obviously, different options. A progression on this one is just to then transition legs. So I want you to do exactly the same thing. This time, all I want you to do is sink yourself down. This time, you're going to jump up. You're just going to alternate legs. So you're going to start quite small. Just get used to this little transition like that. And then we'll start to just increase the height and then increase like how far you're stepping. So start quite narrow to begin. Just want you to sink down and then it's a little change in legs. Yep, cool, perfect. Little jump up. Good, good, good. Keep your head a little bit higher, chest out a little bit more. Perfect. Good. And you could probably go a little bit higher on that as well. Good, perfect. Great. Obviously, key before Jonas does this one is you need to have a good split squat technique. And you can obviously add load to this one. So it's probably not your main plyometric task, but there's no reason Jonas can't come in, add a little bit of weight to that with some dumbbells, and then drive up as well. Okay. What I want to start to get you to do now is, in this stage, we're preparing for single leg landings. So our main goal is, one, get to a bilateral drop jump. We want Jonas in this stage to be able to do really good single leg decel. So you need to be able to do a good single leg deceleration. So for that, technique-wise, all we're going to do is, you can face the camera this time. All I want you to do is if you're going into a walking lunge, so the task you did when you went into a walking lunge, same technique. I want you to step into the walking lunge. I want you to decelerate and just drive yourself back as fast as you can. Okay, so you're just going to step into it and then just push yourself straight back up. Okay, and step in and then push back up. Okay, just have a go at that one. Good, perfect, same again. Good, cool, nice, relax. And then as a prep for this task is something you should do before single leg decelerations. So Jonas is going to, although the focus is plyometrics, the progression from here is Jonas is going to do exactly the same thing, but this time into a single leg landing. But before we do that one, we're going to do some bilateral drop jumps. This is our main criteria for the transition to the next stage. We want to have a really good drop jump before we start to do multi-directional stuff. Well, Jonas, obviously, same as you've already practiced this previously, so you've already done a two-leg landing. And obviously, we've done two-leg squats. We've done some counter movement jumps already. All I want you to do now is just put them both together. So you're just going to land in a squat, and then you're going to jump up and land again in a squat. So you're just going to step off, land, jump, and land. Initially, I just want you to do quite slowly. So I just want you to step, land, tiny little pause, and then straight up into another jump. So if you just have a practice of that first. So just a step off, land, and jump. Perfect, good. Now what I want you to do is just get off the ground a little bit quicker. So I want you to imagine it's almost like a set of hot coals when you land in. Do you get that in Belgium, hot coals? Do you do that? We tend to not really walk on hot coals in the UK, but either. But all I want you to do is step off, land. This time I just want you to get off the ground a little bit quicker. Okay, obviously, key technique here is we want to make sure that Jonas is landing with good technique, certainly not landing with dynamic knee valgus. So we shouldn't be landing coming into valgus and driving up. Once the technique's good, all we're going to do is just go faster and faster and faster. Okay, so I want you to step off, land, I want you to jump as high as you can, but importantly this time as fast as you can. So the counter movement jump as high as possible. We get off the ground as quick as you can. Okay, ready? And step. Good, perfect. Let's have one more go at that one. Good. Okay, I think we can get a little quicker off the ground. This time I want you to focus on just pushing into the ground as fast and hard as possible. Okay, really try and just get off that ground as quick as you can. Okay, ready? Step. Good, good. We can go a bit faster as well. So this time, as soon as you touch it, straight off the floor. Okay, ready? Step. and then get off the floor quick. Good. Okay, good. Probably with this one, in the late stage, you are probably more concerned a little bit with technique, making sure there's some good power, but over time you want to make this faster and faster and faster. Ideally, Jonas, if you've got a contact mat, you want to try and get to 0.2 of a second, where Jonas is getting off that ground as quick as possible. Okay, so that's our main task for this one. What I'm also going to introduce is just some lateral stuff now. So alongside this, hopefully Jonas is starting to run outside. So he's been running on the treadmill. By the end of this stage, we're going to have him running outside a little bit. And he's going to be doing some single leg decelerations. And our goal is to start to, and soon, preparing for a high speed single leg decel, both going forwards and going laterally. So Jonas, by the end of this stage, should be able to do a good single leg decel, and he should be able to do it laterally as well. So we need to introduce a few plyometric tasks to prepare him for that. All we're going to do to begin is I want you to do a step, and I'm just going to get to pushbacks. The same as that lunge pushback that we just did a second ago. This time, rather than standing on this leg and leaning forward, I want you to step into it and land. So the same as this one that you've done previously. So I want you to step, land, but this time I just want you to push yourself back. So it's the same as that lunge pushback, but this foot's off the ground. But if you do it on the mat to begin. So just all it's going to be just step from one leg onto the other leg. Just want you to single leg land, good control, and just push yourself back. Okay. Be careful of your back leg when you push yourself back here. Good. Okay. Good. Same again. Good. Variation on this. Obviously, Jonas, you can just this time just running into it, you can just do a little bit of running on the spot. Again, just land, just push yourself back. I want you to start to try and land for a little bit less time on the ground there. So the moment you're going really quite low and you're holding it for a while, I want you to just try and push yourself back a little bit quicker. But go into a run first, land, and then push back. Good. Good. Same again. You can start to just alternate legs, so go left leg into right leg. Good. Perfect. Okay, relax there. Same technique this time, but all I want you to do, rather than going forwards, we're just going to go sideways. Okay, so in the screen, exactly the same thing basically. I want you to do, rather than a forward step, sideways step. So you're just going to step out to the side, so the same as those side jumps that you've done. But I want you to land it, just push yourself back. Okay, we'll start on the mat to begin. So just a step, not the fastest intensity. I just want you to do a little jump, and then push back, and then we'll start to quicken it up. Good, perfect. Okay, good. Same again. Good. Okay. What I want you to do now is, rather than leaning so far into it with your body, I want you to keep yourself a little bit more upright. So the moment you kind of lean into it like that, I want you to stay a little bit more upright, and then push back. Okay. Good. 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 Okay. All we're going to do now, same progression on here, is just to make it a bit more natural. So Jonas has done this side step. All I want you to do again, just from a run, just a little push back into a run, push back. Just do sort of 4 on one side, 4 on the other side. Good. 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 Don't need to be super critical on technique, but Jonas is a little bit too toe dominant at the moment. So as you're coming in, you're tending to land on your toe, and you're pushing back up. I want you to try and get that heel down a little bit more. Land a bit more through your heel and push yourself back up. If you have one more go at that one, so rather than landing on your toe and pushing back from your toe, try and get your whole foot down, put your weight through your heel, and then push yourself back up as well. Good, 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 good. Obviously, you're going to have to think about it, so it's going to slow you down a little bit. But as we start to progress through, make sure you're not having too much pushing through your toe. And then progressions on that one are essentially get rid of the mat. Same thing, all we're going to do here is just using the screen, Jonas. When you come into a side step, which to land and just push yourself back up. Just go into some side steps, land, side step, land, okay? So the same as that task that you've already done. So you've done a side step and land before, but this time I just want you to land and just push yourself back. So into a side step. Cool, keep going. It takes a little bit of getting used to. Good. Good. And then I will maybe edit, but pretend that we started with this one. So rather than doing that task there, all I'm going to do this time is single step into it. So I've just got Jonas there to do a side step into it, but what you should really be doing is a single step into it. So whenever you introduce these tasks, you don't want to start with a run, you just start with a single step. The same thing here, I want a single step, land, push back. So from here, just a little push, a single step, land, push back. Good, and then all I want to do here, technique-wise, just try and get off that ground a little bit quicker. So this thing, just focus on pushing back. Good, perfect. Good, good, nice. And then what we can do then is just add an extra step in. So rather than one step, we'll go into 2 steps. This is where you'll think about it. So you go bang, bang there, push back. Push back, might end up in 3 steps, of course. We're just going to introduce it, focus on that side push, and then we can start to increase that distance. And all you're doing here is using a plyometric task, but to prep Jonas for going into side stepping and interchange of direction tasks. So it's using a plyometric variant to help support his progression on the field as well. Okay, so just same again, just a couple of steps. Good. 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 And then on this one, what we can start to do is to add in both sides. So probably won't use this with a force plate here. I'll just have a cone one side, a cone the other side, which I'll do because I've got cones. So not on a force plate this time, Jonas. All I want you to do is, again, you're still going to do that same movement, little push. I just want you to go side to side. So it's just here, focus on that little push into a little side step. You might have a few little steps in here as well. You can, as a preparation for this, just use your ladders. So I'm not a huge fan of ladders for speed development, but they are quite good in rehab. So all you do is, you might have your ladders here. You might just go into a couple of steps, have Jonas land and push back. So he's getting that little bit of control, and then you go into this task as well. But I've already done the ladder one. What I want you to do, Jonas, is just nice and natural now. Don't think about that push. Just into a side step. Just make it nice and natural in the middle. Just push off side to side. Good. 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 There's no number of steps. If you want to do less, you've got longer steps than I have. Good. 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 Okay, relax. And then all I want to do now is start to speed up that push off here. The moment you're kind of coming in, you're landing for quite a while. It's taking you quite a bit of time to get out of the side here. So I want you to slow down this bit. I want you to focus on pushing off a little bit quicker. So what you can do is less natural. This is where the ladders do help. Is just do a little bit of a run, push off, push off, push off. Okay. Good. 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 Okay. Relax. Cool. Good. So everything so far has been linear. So we've done some forward stuff. We've done some sideward stuff. Sometimes Jonas or other patients might also be going outside at this stage and doing some on-field rehab. They might be doing some running, some sidestepping. But importantly, plyometric tasks should lead into the movement progressions. So it should be part of your overall movement program. So we can do it in this kind of setting where the focus is on movement, using a plyometric task, a discrete task. We're then trying to feed it back in to Jonas's overall movement plan, which is overall movement plan. Can we get him sidestepping really, really well? But we're going to use this kind of variation where it's a land and a pushback to get him there. So it's just taking a discrete task and then adding it back in. So the question was, how do you progress from deceleration, kind of straight line decel, to kind of single leg decel into like a cut? Right, yeah, brilliant. So that's probably where you do feed into the next stage, which is stage 3. So everything so far has been linear. So going forwards, going sideways. But obviously, as I said, we've got to now get into a change of direction. So the key part here is using plyometrics for that progression. So I want to now use multiplanar plyometrics for my movement retraining. But now I'm also going to use the other plyometric tasks now for power development. So in this environment, we're training movement. But what I'm probably going to do now is any of the plyometric tasks that Jonas would have done in this stage, I'm just going to maybe take it out of this area and just do it in this gym program. So Jonas now can quite easily do counter movement jumps. But I'm not going to bother so much doing counter movement jumps with a movement focus. I'm going to just feed it into Jonas's strength program. So now Jonas in the gym is going to do heavy load squats, followed by counter movement jumps. And our focus in this kind of environment or on the pitch is now to transition him into multi-directional movements. But it doesn't mean you forget the stuff that Jonas has already done. It just means now you add intensity to that task. So Jonas can now do counter movement jumps as part of power development. He's not doing it for movement restoration. So movement-wise, to begin here, we've got to get Jonas going from a bilateral drop jump. So we can do a bilateral drop jump now as part of your program. Why drop jumps are different to counter movement jumps? Biomechanically, they're pretty similar in terms of technique. But a bilateral drop jump is going to have a ground contact time of about 0.2 seconds. Or a counter movement jump is a slow stretch shortening cycle that's going to have about 500 milliseconds. So we want to start to now use the 200 millisecond bilateral stuff, really explosive. So that's why we've got counter movement jumps for concentric power, but now we need bilateral drop jumps that Jonas can do in his gym program as well. But our focus now on a movement perspective is got to take Jonas from being able to do essentially this to being able to do this. So kind of a 90-degree cut, which is by the end of period stage 3, we want Jonas doing cutting, multi-directional cutting. So now we've got to go to multi-directional plyometric tasks. I'm going to start with diagonal work. So all we're going to do to begin, Jonas, is so far we have done this pushback. Okay. All I want you to do now is just going to do some multi-directional pushback. So all we're going to do is just lean into there, just again a little bit of a pushback there. Just get you doing this one, little pushback. Okay, just have a go at that. Good, 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 good. Good. Okay, just as a progression now, all I'm going to do is just get you to step into it. So it's more of a movement progression rather than a plyometric task. All I want you to do is just step and land, a little bit more of a diagonal. So far in the previous stage, Jonas has done a side step. Now we're just adding in a 45-degree angle, so it's into that movement. And the goal here is to get you into a cut. But all I want you to do is just diagonally off the force plate there. Just want you to step and land. How's the camera? Sorry, can you see his technique a little bit? Or yeah. Again, if you want to come in, I don't know. How's it look? I'll just have a look how it looks over here. Oh, that's good. Oh no, yeah, it's hard to get a force plate, isn't it? Yeah, cool. So there, Jonas, as a movement prep, so the task we're going to do now is basically, I'm going to get you to basically do this task into a cut, okay? But the preparation for that is to make sure that you're able to do that pretty safely, okay? So we're going to do this on both sides. First, I want the landing to look good, and we'll do some diagonal jumps as well, okay? So just single step again, single step into a land. Good, cool, cool, cool. Just do that on both sides. So do a couple on this side, good, and then come out to this side as well. Just get used to so on this side, just get used to that jump off this leg into that leg. Good. Good, 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 good. And then alongside this, so as we try and progress Jonas into being able to do this cut movement here as a kind of plyometric task, we're also going to add in some single leg jumping as well. So now you're going to be doing a lot more propulsion work on that one leg. So all we're going to do there is, as a task is head into some single leg jumps. I want you to start out, sink into a squat. I want you to just jump up. I just want you to land on 2 legs. Okay. So alongside this, we'll do another movement variant that Jonas should have done already. With single leg, sink into a jump. Good. You can get a little bit higher off that as well. So again, sink into a squat, jump as high as you possibly can. So we're starting out with this program with single leg counter movement jumps. They're still slow stretch shortening cycle. Our goal is to get to a single leg drop jump. So we're going to start out single leg. The reason we're landing on both legs is we're taking away that impact load. So we're sharing it across both legs. So same again, just have another go at that. Good, perfect. And then variation from there, all I want you to do now is we're just going to do a diagonal step, and then I want you to do a diagonal step to the other leg. Okay, so we'll probably just do it across the room here, to be fair. So all I want you to do is just going to step, land, step, land, step, land, and we're going to gradually speed up those steps, okay? Land, good, push, 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 good, good. And then all I want you to do after that is this time add it into a bit of a run. And I want you to just step and push into that leg, okay? I want you to focus on getting this step off a little bit quicker. So there, rather than going hold, hold, just focusing on a single step, can just be a little run on the spot, just want you to push into the ground, land on that one leg. So again, push into the ground, land on that single leg. Good, brilliant. Same again, keep going over that one, try and get that step a little bit quicker. Good, perfect, good. One more of those. Good. And then all we're really prepping Jonas here for is that 45-degree cut. But we're using a discrete task and then adding in speed of entry, trying to reduce that ground contact time as well, trying to get him doing it faster and faster. So we first introduce it as a coaching point, then we get it that a little bit quicker. We haven't got ladders here, have we? Or do you use them? Do you use them indoors or just outdoors? I like them indoors for this. Cool. So going to revert back to the ladders. Hopefully no S&C coaches are watching. Cool. So technique-wise now, all I want you to do, Jonas, is going to one extra step. Now what we're going to do is just head into, rather than a 45 degree, I want you to go into a 90 twist, okay? So what I'm going to do is get you to stand here to begin. Stand on one leg. All we're going to do is just a jump and then land, okay? So you've already done that task. Remember the task where you had to do that little turn like that? That one, you've got to keep your knee nice and controlled and rotate around. It's a horrible technique by me, but just keep the knee nice and controlled, rotate a bit through the hip. So just have a quick look at that. Just make sure the balance is quite good. Good. And then all you're going to do is similar kind of technique. I just want you to do a jump and rotation. So you're just going to go from here. You're going to land on this leg. Okay. So standing on that leg, jump, lands there, good control. I want you to then jump back in. Jump, land, jump, land. Okay. You just come into that one there. So practice it first off just with a single step and lands. So here is basically focus more on. This is probably the plyometric sort of single leg jump. You can maybe make that a little bit further on the jump. Now we'll just focus on just jumping off this leg, landing on that leg. Don't worry about the jump back. Good. Now just try and make it a little bit further. Good. So again, adding in now single leg landings, single leg rotation jumps. Progression from this is we'll start it out here. All I want you to do is just a turn, and I want you to now focus on this step. Okay, so this is where it gets a bit tricky. This is where you've got to be a bit more careful because you're starting to now introduce rotation moments into Jonas's program. So the danger here is as soon as you introduce rotation moments, you start to see a lot more valgus type movements. So all I want you to do now, Jonas, is a step. I want you to land there, but rather than holding it like we were doing before and coming back in, I want this step to be a little bit quicker. Okay, so just a step, turn, good, brilliant. Good, just let your knee track a little bit further forward, so just allow that knee to come a little bit more over your toe. Good, perfect. And then all we're going to do there, just the progression. So you've done this task already, where I got you to push out and push back. All I want you to do now is same thing. I want you to do a step, land, and then rotate yourself back in. So it's a little step there, land, back up, across, land, back up, okay? Good. Good, a little bit of a higher knee lift in here. And then, good, just relax for 1 second. So just remember when we were doing the skip movements, I was getting you to drive down a little bit faster. Same one here. So at the moment it's a bit too much of a knee lift. I want you to focus on driving down a little bit quicker before you go into that task. Okay, so just focus on that little bit, drive down, good. Land, good, 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 cool. So what we're at now is, Jonas is at multi-directional plyometrics. Obviously, we're using a movement task here to prepare him. At the same time now, with our tasks that we did in the previous stage, we have to now do these at higher intensities. So all of our linear type stuff, so forwards and lateral, we do the same task now at higher intensities. So that means higher entry speeds, that means higher drop heights. Before we do these lateral plyometrics, like I've said, all we need to do now is, we've done everything so far stepping. So everything's been one leg onto another. But what we want to start to introduce now is unilateral plyometrics before we really go into multidirectional plyometrics. So here we're going to start off with single leg hopping. So Jonas, if you just stand on the fourth plate. Yeah. So far everything has been jumping either on two legs or jumping from one leg onto another. Now we're just going to introduce jumping and landing on the same leg. So what you do is think into a single leg squat. You've done a jump up and you've landed on two. That's what you now just think, land on one leg, okay? So jump up, land on one leg, perfect, good. Good, and then just do two on the right side as well. Good. Good, a bit harder on that one, no? Cool, so same again, so do single leg hopping, same version, just going to do it laterally. So now what I want to do, Jonas, is going to do a little side hop and hold, land, hold, hold. Just going to do sort of 3 back and forth. So we're going to progress now into, rather than hopping upwards, we're just going to do hopping sideways. Good, land, control, good. And back in, you can have quite slow to begin. Good, 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 brilliant. Now what I want you to do on this one is I want you to focus on this pushback a little bit faster. So rather, I don't want you to jump quite as far, but I want you to push back a little bit quicker. So as you hop, I want you to get back onto this force plate. So again, imagine this is like a hot coal or something. You've got to get off back to the safe zone here. So you're standing here, little side hop, off the ground, back onto the force plate as quick as you can. Good, 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 good. Good. And obviously, as a task, this is a prep for higher speed lateral movements that Jonas can either do indoors or outdoors. So now Jonas is outdoors, is going to be doing things like really, really quick side steps. Kind of, we've done some prep for this indoors, but this task will prepare you for a lot more faster side step work as well. Progression on this is, again, variations. You've got just going into a rotation movement. Again, starting out nice and controlled, but this one's going to be done a little bit slower. As a progression laterally, you're just going to vary up the drop heights that Jonas is landing from. So this time, Jonas, the same thing that you kind of just done, where I got you to hop. I want you to do it now onto the box. So we're going to do single leg box jumps. So first you've got to do a single leg box jump, just a hop and hold. Get you to do that first, and then I'll progress you on to a couple more. So first you should be able to do a single leg hop and hold. Good, perfect. Step back down nice and carefully. Good. Brilliant. Now I want Jonas to be able to do a lateral hop and hold. It's the same thing. Little jump up and hold. Good. Just make sure Jonas can do that nicely going the other way. So Jonas this time, rather than hopping that way, I want to hop this way. So just a little hop onto the box there. Good, perfect. Then what you can start to do is put them. Probably shouldn't do that. No, you're cooler. So same thing. So you've done this one, Jonas, and you've done this one. Now I want you to definitely harder going up on that one. Now I want you to basically go from this one to that one to that one. Pause, then go again. So something like this. So again, imagine this is now the hot coal, but first do it quite slow. So it's going to be a land, and then jump back up. Ideally, probably introduce this a little bit of the lower box, so you're not going to do this straight off. But Jonas will be fine doing that. So again, to hop there, hold, back up, back up. So these are pretty high demanding tasks. Jonas is probably able to do these in the next stage, so kind of return to sport when Jonas is back playing. But on a slightly lower step, Jonas will be fine doing these. Cool, just have a go on that one. This is pretty hard. Good, then land, control, step back down. Good, good. Get you just to focus again on that heel. Yeah. So now we've gone a bit faster. You've now gone more onto your toe. Good, perfect, good. Good, nice. Then this for slightly lower steps would offer, just again, progression for Jonas. Same thing, all the way to do now, just into a lateral hop. So that same thing we did on the ground, just now going to jump onto the box. So again, single leg box jump, but with a rotation. Good. What I want you to focus on here, though, is what you did there, is you twisted with your body to get that momentum. Yep. I want you to sink into the lower leg, try and drive into the ground to get the momentum. So rather than kind of twisting your body, so there, just try and push yourself up. Okay? So don't let your body sway too much. Good, my demo was wrong, but you did it right, good. So little drive up. Good, 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 good. Same again. Good. So progression on that is, obviously now we need to do the other side. So again, Jonas can jump from there and have that rotation. This is going to prep Jonas for really high intensity demanding 90-degree cuts that he has to do when he's returning to sport. The nature of this is it's still slow stretch shortening, so it's quite long. And it's quite long, ground contact time. So it's probably about half a second, 600 milliseconds. So it's quite high eccentric loading. So Jonas needs to have good eccentric strength. And obviously, it's going to prepare Jonas more for change of direction type tasks that involve these kind of ground contacts. So again, a little jump up into that one, and then we'll. Good, perfect. Then what you do the same now. This time, all you're going to do is add them both in together. So you can do a little. Great demo. Right, into there, little land. Then I want you to come back into that position. Land, come back into that position. Temporarily get rid of this box. So just a progression. This is pretty demanding. Good, relax, good. Good. So again, these are demanding tasks, but I've done about 30, 40 progressions into these. So never introduce this task unless you've had lots of preparatory tasks. Jonas has performed each of these safely and with good proficiency, but this is a task you're not going to want to introduce unless you're pretty confident that they can do this well. Good, so progression. No, that's cool. Now, focus is now just, again, prep in front of the screen, so you can use the screen for biofeedback. What you want to do at the end of your late stage rehab is to make sure that the cutting biomechanics is really good. So Jonas should be able to come in and do a really good, proficient 90-degree change of direction. So we've done some preparatory tasks for Jonas. So he's done some rotation jumps, he's done some steps into a rotation, but now you can start to vary up the horizontal speed of entry. And this is where plyometric tasks form the basis for your movement, your cutting progressions. Now, biomechanically, cutting is a kind of plyometric task. It involves eccentrically accepting load, amortization phase, concentric propulsion. Ground contact times, depending on the cut angle, you're looking between 300 to 600 milliseconds, depending on whether it's 180, 90, 45-degree cut. But now I want to try and take the plyometrics into the movement progression. So Jonas can do these as a prep. Now what I want you to do, Jonas, is the decel task that we've done before. So we've done this one. What I want you to do now is add this task into your higher speed decel. So you're going to run forward, decelerate, and then just push yourself off. So just a 90-degree change of direction. So little step, hold, and then push off. So the same as that jump that we did, same technique. You're just going to have a bit of a run into it, okay? Just a few steps to begin. Good, good. Same again, a little jog back out to here, and then run forward. Good. What I want to focus on here, as you're coming in, you're starting to sink and your toe is going forward like that. So as you're coming in, you're kind of landing, but you're sort of drifting forward onto your toe. I want you to sink into it a little bit more and keep your heel on the ground. So rather than letting your toe come off like that, I just want you to get a little bit lower and just push into the ground, keeping your heel on the floor. Good, 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 good. Little jog back in. Good, 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 good. So more of a cut, but the only reason I've thrown that one in is your plyometric tasks should prepare you for functional progressions. So our main functional progressions are running on a treadmill, single leg decelerations, bilateral drop jumps. We want to be good at lateral landings, and we want to be good at 90-degree cuts, 45-degree cuts, 180-degree cuts. So plyometric tasks should prepare you for those movement progressions. Yeah, progression on the field. So I guess question was, what criteria would you recommend for transitioning people out onto the field? Mostly as you start to go outside, depends on what clinic you've got and what room size you've got. So here, ACL Plyometrics have got a reasonable sized movement room. So there are some tasks that you can do inside that people in smaller clinics wouldn't be able to do. And again, when you're thinking about your plyometric tasks, you've got to consider the constraints that you have. You've got to consider your coaching confidence, the time you have with the patient. You've got to consider the strength testing that you might be doing around the patient as well. Now, I'm a big fan in criterion-based rehab progressions, and I think that in order to go on field, you should have an 80% limb symmetry index as a minimum, but you should have an 80% to enter late-stage rehab. So I would say before we were doing second-stage plyometrics and we're doing single leg landing and bilateral plyometrics, you should already have good strength. You should have a good single leg press strength, so again, 1.25 times body mass. When you go onto the field, I think it should be higher, 1.5 times body mass. But importantly for me, before you go outside, you should have had some movement prep. So done some of these plyometric tasks, done some of the preparation movement tasks. So you shouldn't be going outside and doing on-field work if you've not done lateral landings, side steps, multi-directional plyometrics. But it depends on your facility. So if you've got a pitch next to you, you can introduce on-field rehab quite early. So you can have someone go out and do 20 minutes of running and movement work outside. But if you don't have a pitch available, you might have to wait a little bit longer. So I don't think there's a perfect, you have to have this to go on field. I don't think there's enough research to tell us either. But importantly, before you practice a task outside, you should have done a similar task in a more constrained, safer way. So before you introduce lateral sidestepping outside, you should have done some lateral landing and lateral hopping inside. But I don't think there's like a perfect criteria at the moment. Cool, good question. So question was, do you think you need a force plate, basically, to progress patients moving forward? Or do you think where you haven't got technique available that you can just use qualitative movement to try and progress your patient? Personally, I don't think you need a force plate, and I guess you'd be happy to hear that because virtually no one has a force plate. I never generally use the force plate, and I didn't have this kind of setup with cameras and a force plate. I personally quite like using mirrors, and I probably prefer using mirrors than screens with biofeedback like this. The main reason is because when a patient sees themselves in a screen, it's slightly different to seeing yourself in a mirror. So I do like using mirrors for looking at biofeedback and for movement practice. I think force plates can help us. I just don't think we know enough yet. I wouldn't personally feel confident interpreting Jonas's cutting force trace to know if he's safe to go out. I don't think there's enough research there at the moment. I think sometimes we can become too reliant on technology. I'm a big fan of just spending a lot of time coaching. Your exercise becomes your test. I think sometimes like criterion-based testing is nice because it allows patients to gain objective information, and a lot of times patients want to leave and they feel overly confident. So sometimes having objective data there that you're not just seeing with your eye can help you. So sometimes just saying to the patient, okay, we've done a movement screen and you're at this score, we really need you to get there. So we need you to have a little bit longer. Sometimes the research isn't there though. So you've also, ethically, you've got to inform the patient as to what your current understandings are on that. But no, for me, I think that you should be able to coach a patient and be able to see them. The test is the exercise. The only issue with that is you need to spend a lot of time with the patient. So I think it depends on your model of rehab, whether you're like a distance rehab where you're prescribing from a distance, like a telehealth perspective, and you're asking patients to do certain tasks, and you're demonstrating them the technique and saying, okay, do this task, and then come back. I think that's maybe where testing can really help. If you're spending a lot of time with the patient day in, day out, the exercise becomes the test. But it really depends on the constraints that you have. Do you have the technology? Do you have a force plate? Do you have a camera system? High-speed cameras like this are nice, but equally, if you want to do some movement screening, iPhones are good. Something like Coach's Eye or some kind of like a Canovia technology where you can look at someone's movement quality. And also, I think making sure that they're just moving well through your progression. So with Jonas, I've done lots and lots of different progressions. I wouldn't do this normally as a single session. This would take weeks and weeks and weeks. But the only way you can know that Jonas is really safe to progress through all these different tasks is through good proficiency. So he performed all of the tasks really well. So I know he's safe to go on to the next one. If you start to perform them, without confidence and without good technique, then that's when you'd have to hold him back a little bit. So I think you use like an understanding of movement to guide people through the progressions, looking at how intensely they can do them as well. But yeah, they definitely don't need a force plate, definitely don't need camera systems. Not to say that they're not useful. I do think that if you've got access to that and you've got the resources, brilliant. If you haven't, then rely a bit more on coaching as well. Yeah, so plyometric training. So the question was, in terms of going back to running, using plyometrics to prepare for running, what plyometric tasks are we using for that? So that's really where stage 1 plyometrics were designed. A lot of the time, people don't do plyometric training until towards the end. You could probably argue that some of the earlier plyometrics aren't necessarily plyometrics. Depends how intensely they're performed. So they may not be a true plyometric. It might just be like a movement variant. But importantly, the plyometrics in the first stage to prepare for running. For me, that's where things like the lunge pushback help. You can argue, is it a plyometric? Technically, it does involve a eccentric acceptance. It does involve a concentric propulsion. That kind of sink down and push back. It's teaching them to eccentrically accept load and then getting that concentric propulsion. Because you've got this leg that's offering you a little bit of support, it's a bit safer to introduce than getting people to do this one. So you can do this task before you do single leg jumping. And I like to just do it as a progression. So you sink down into it, you push back, then all you say to the patient is, what you did there is just sank into it and push back. All I want you to do is jump into it and land. So then you're just teaching them to jump into it and land. Patients should have good single leg control before they go into running. So if they can't do these kind of tasks with good coordination and technique, probably not going to be running with good coordination and technique either. So you want to make sure that they are comfortable doing single leg stopping, single leg landing tasks, but not intensely. So in this stage, you don't want to do really, really high speed single leg landings, but to prepare for running, you should be able to do these little step and holds. Now that's not really so much a plyometric task. It kind of is a slow bounding, but I'd start with this kind of thing. Counter movement jumps onto a box. Although it's bilateral, you're teaching the faster stretch rates that you're not getting in your strength training. So the patients probably at the moment are doing bilateral squatting. They might be doing maybe split squats with some weight, kind of functional strength training. But the stretch rates are probably not as fast as you want them to be. So that's where you start to introduce counter movement jumps. So a bilateral counter movement jump is going to have slightly faster eccentric rates of force development than you're going to be getting in some of those tasks. So although it's bilateral, I'm more concerned with, can I start to get that eccentric loading and eccentric rate of force development in this task that I'm probably not getting in my strength training. Strength training is not very good for training rate of force development. Plyometrics is very good for training rate of force development. So probably return to running. I think you should be doing counter movement jumps onto a box. You should be doing these kind of lunge pushbacks. You should be doing single leg landing drills on some kind of soft surface where you're just teaching them to just land with good control. But importantly, bilateral counter movement jumps, slow stretch shortening cycle. So it's kind of quite long ground contact times. You're not doing drop jumps yet. So bilateral counter movement jumps onto a box to get rid of the impact loads. These kind of lunge pushbacks. Again, might introduce some bilateral jumping with a slight offset, not too much. We might just start to get them doing a little bit of this, but then maybe progressing just into these little split ones like that, and then a little bit of skipping type stuff. Not too much, but I would just say 4 or 5 variations that you want to have before they're running. I don't think they should just run. They shouldn't just do strength training and then run. They should do some kind of plyometrics. If you have a pool available, then you can do all of these tasks in the pool. By doing them in water, let's say this height, you remove 50% of the ground reaction forces on landing. So you can start to introduce most of these kind of bilateral counter movement jumps. You can do them in the water rather than onto a box because you're getting rid of all of those impact lands. But yeah, definitely should be doing plyometrics before you run. Just me guessing what you should do. No research out there saying really what you should do. Help? Do you agree? Yeah, question is saying not doing plyometric training yet before running. Why are you not doing plyometric training? Just in case, yeah, the mic didn't pick that up. You're saying not doing plyometric training before running, but doing single leg squatting. Not really thought about doing plyometrics as a preparation into running. I think, yeah, traditionally, a lot of people don't do it. But there is probably some people who are doing plyometric training before running, and lots of people that are not doing it. Importantly, running involves different biomechanics to squatting. So if you're doing a single leg squat, yes, it's a unilateral task, but it's over quite a long period of time. You've got time for feedback, so it uses the feedback loops. You can kind of control the body. The stretch rates are a lot lower, and the impact loads are a lot lower. So single leg squatting, you've got body weight impact. You're kind of pushing up about 85% of your body weight. It's called like the incumbent weight, the weight above the hip that you're lifting. So I'm kind of lifting my body above my hip, and I'm lifting this leg. So that's about 85% body weight, but it's not going to prepare you for running unless you're doing single leg squatting, and you're doing maybe 50% body weight as an extra, which for most people, they're probably not doing that at that stage. So on a loading perspective, running is in excess of the load capacity to what you're preparing them for. So you're only really training them at maximum body weight. You probably could stick them on a leg press and do eccentrics on a leg press. So going up on 2 legs, going down on 1 leg. That's a good prep for plyometric tasks. So a good prep for single leg landing is single leg eccentrics on a leg press, because you're starting to get the eccentric loading that you need, providing you can do 1.5 times body weight. And then you can start to do them faster on the leg press as well. Push up on 2, down quite quickly on 1. Again, that's going to prepare you for single leg landing that you need in running. But yeah, I'd say do plyometrics before, but it doesn't need to be too many. Again, just a couple of exercises to prep them, gives them a bit of confidence, and then when they are running, hopefully they are. Comment there was, obviously the focus sometimes is running, focusing when they're on the treadmill, trying to restore running gait, and correct them as they're running on the treadmill, and presumably using some kind of camera system, right, like a coach's eye or something that you're doing. So yeah, I'd say, obviously, sometimes if you introduce someone to running on a treadmill, and you've not done landing, bilateral plyometrics, eccentric strength training, then the technique's probably not going to be great initially. So you're going to then start to look to change their technique, but the technique might be slightly better if you went through some additional prep. So where you did eccentrics on leg press, you did landing on a trampoline, single leg landing on a trampoline, single leg landing in a pool, and you did bilateral count movement jumps onto a box. If you did all of these preparation exercises, typically the running gait at the start of running is a little bit better because patients are slightly more prepared. Otherwise, they just won't have the neuromuscular capacity to accept the loads that you get in running. So they're going to show lots of compensations. And what you might do there is you might see a compensation and start to retrain it, but then they'll just show a different compensation because they haven't got the capacity, neuromuscular capacity to yet run, to experience 1.5 to 2 times body weight eccentrically, and to do that stretch shortening cycle is not prepped for that. So I'd say do a little bit more prep, and then when they do go into their running, they should adapt a little bit quicker. Because otherwise you might say, okay, I'm filming you, I can see there's a slight lateral trunk lean, I want to focus, say, more upright. Then all of a sudden, rather than offloading to the frontal plane, they might run with a stiffened knee. And all of a sudden they show a different compensation. Whereas rather than focusing on the technique, if you focus on the neuromuscular capacity, they might not need to show those compensations as well. If that makes sense? Yeah. Good question. So yeah, kind of weekly frequency for doing plyometric training. They progressed on the field already? No. So looking to progress someone outside. Yeah, looking to progress someone outside. So they're kind of nearing the end of their late stage rehab, looking to go into return to sport training. Now you should do return to sport training before you send them back to the team. There's a whole new stage of return to sport training, which should last about 3 months post ACL reconstruction. So once they're able to complete late stage, they've got another 3 months that they should do. But yeah, in order to kind of progress them out, I would say they should be doing probably plyometrics twice a week. But it depends on your setup again. So you might have a room like this where you focus on movement and you'll do plyometrics as part of a movement session. And then you might have a strength and power session that you're doing in the gym. So you might send them to the gym and you might do plyometrics as part of that session. So you can use it for movement restoration and you can use it as part of a strength and power session in the gym. So I would say they should be doing 2 a week, probably at least 1 strength and power session in the gym, at least kind of 1 movement retraining session, either in something like this, or even if they're just in the gym and have got like a small area, you can do single step lands, etc. You don't need as much space. But yeah, they probably should be doing at least twice a week, ideally. But you can do it for different purposes. So again, you can do it as part of a movement, core and movement session, include plyometrics. Your strength training work, what you can do is you can do contrast training where you're going from strength exercise into a plyometric task as well to focus on developing strength and power. So hey, I'd say a week volume of twice a week. You do want to count the number of foot contacts that you're doing. So normally with plyometrics, it's on foot contacts. But as we kind of said in this video, that plyometrics have different intensities. So you can't say that this is 1 foot contact and then something like this task equally is 1 foot contact, because they're differing intensities. So you should also start to think about, is it a low intensity, a medium intensity, a high intensity? And you should look at foot contacts according to each of them. You shouldn't increase both intensity and volume at the same time. So if you're going to increase, you might say, okay, I'm going to do 50 foot contacts, but I'm going to add in a slightly more demanding task this week, but I'm still going to do 50. Then you might do the same session and then do 60 foot contacts. But make sure you look at foot contacts, but consider the intensity of the task as well. 50 bilateral drop jumps or single leg drop jumps are going to be quite demanding. Starting point, foot contacts based on the movement quality of the patient. So I would say, firstly, the task should all be done with good quality anyway. So if someone's doing the task with really, really poor quality, I just wouldn't do that task. So if they're doing a single leg hop, so you do loads of single leg hops and you're falling into really bad valgus and really poor control, then I just wouldn't do that task because it's not done with good proficiency. So each task should be done with good movement quality. So I would try and take movement quality out of the equation to some degree by choosing the right task. So as long as they're doing the task with good technique, then you can kind of presume that that's like you wouldn't say, okay, well, that needs to be more loads than if they do it with poor technique. Doing a single leg hop with really poor technique and valgus is going to stress up the ACL a lot more than if you do it with good technique, but you shouldn't be doing it with bad technique really in the first place. The kind of spin of that is as you start to go more towards on-field work and stuff outdoor, you don't want them focusing too much on technique. So you do a lot of your technique stuff in and around this area. But then when you do your plyometrics in the gym, you want them focused on strength and power. So first I introduce a plyometric task to get good movement quality, and then after that it's about good intensity and good power. So when they're in the gym, I don't want them thinking every single second about, okay, don't have valgus. Teach them good technique and then just get them practicing it over and over and over. As you start to go outside, you don't want the patients thinking too much about the technique. You want them to be thinking externally, external focus of attention. You want them to be focusing on the environment. So really everything in around this area is a bit more safe, a bit more controlled. You can use something like a screen or a mirror where you get people to look externally. So rather than telling them to look down at their knee, we know after ACL reconstruction there's an increased visual reliance on the knee. So rather than getting them to look down at the knee like that, get them to look into a mirror, get them to look into a screen, get them to focus externally. Then hopefully they start to relearn that pattern over time. And when you go outside, it becomes a lot more automatic and a lot more of an external focus, more specific.